Here are 4 tips for chronic low back pain. When we look at the cause of low back pain, the focus is typically on biological factors. Muscles like the transverse abdominis, the multifidus, the QL, the hip flexor, the glutes, the abdominals, all those muscles are either thought to be tight or weak, and that's what's causing the pain. The problem is that a lot of these findings are inconsistent. We see that they're more of a protective mechanism as a response to pain than they are to a cause of pain. The body changes both muscle activity as well as movement patterns to avoid pain. And so if we're focusing just on the muscles, we're actually focusing more likely on the outputs of pain than we are the inputs. So if we're looking at actually treating low back pain, we should be focused on more of those inputs that are leading to those changes. Which leads us to the question of what is actually causing chronic low back pain. And it's usually a combination of biological, psychological, and social factors that all contribute to the development of low back pain. And this is important because generally the focus is only on those biological factors. So looking at those muscles that we discussed earlier, like the transverse abdominis, the multifidus, or the psoas muscle. And exercise can be beneficial in addressing those biological factors. But the problem is that those psychological and social factors are typically overlooked. So we need to be aware of things like anxiety and depression, which can also be contributing to chronic low back pain. With persistent pain, it's frustrating, so it might be tempting to get an X-ray or an MRI to look at the structure of the spine to see if there's some structural abnormality that's leading to this persistent pain. Of course, if there's an indication for imaging, then we should get imaging. Usually this is when there's a suspicion that there's a serious pathology that's causing the pain, something like a fracture, cauda equina syndrome, cancer, or an infection, and these can all be identified with a thorough history and physical exam. So if there's an indication for imaging, of course we should get imaging, but if there's no indication, then maybe we shouldn't get imaging. And the reason why is because routine imaging actually increases our chance of having a spinal surgery, even though the treatment outcomes of surgery compared to non-surgery are the same at 1 year. Additionally, the results of the imaging can actually worsen our perception of the back condition, of our chances of returning back to normal, of our pain severity, as well as our functional outcome, none of which are what we're trying to achieve if we're getting treatment for chronic low back pain. And part of the problem with routine imaging is that the association of structural findings and low back pain is generally poor. Some common findings that we see on imaging include a loss of disc height, disc degeneration, disc herniations, and modic changes. And this study here found that there was no association between any of those things in either current or future low back pain. In fact, a lot of those findings are seen in those without low back pain and are more closely associated with age than they are with pain. So despite how commonly these are given as a cause for low back pain, the research doesn't support that claim. Whenever somebody mentions low back pain, the common treatment recommendation is to do some sort of core strengthening exercise. And core strengthening exercise can definitely be beneficial, but they're not the only exercise option available. An interesting thing is that it's not actually clear how exercise helps with chronic low back pain. It used to be thought that a weak core was causing instability, which was leading to pain. But this doesn't actually appear to be the case, and it doesn't appear that strength is actually the mechanism of how exercise helps with low back pain. And that's partially why when we look at effective exercise options for the treatment of chronic low back pain, we see that we have many different options. Things like general strength training, Pilates, yoga, aerobic exercises, McKenzie exercises, all of those exercises can be beneficial for the treatment of chronic low back pain. And the reason why this is important is that if you're not responding to core strengthening exercises, we don't have to continue to keep doing those core strengthening exercises, hoping that the muscles will get stronger and then eventually we'll be out of pain. Instead, we can look for an exercise or movement that we actually respond to help decrease that pain. So hopefully these 4 tips on chronic low back pain were helpful. Go ahead and leave a comment down below which one you thought was the most helpful. I'll leave a video over here for some more information on low back pain. I'll see you in the next video.